What's up, everybody? I like getting questions from you all because we get to talk about what you want to talk about. And so this one is from Don Allen, and it says, "Why do we pay for healthcare, but our mouths and our eyes are separate as if they are not part of our body?" And I responded to him, "This would be a great video idea." I put my response, but I'm going to tell y'all right here. The answer is, as most of you probably have guessed, history and money. So before health insurance existed, if you got sick, you paid the doctor directly. There were no premiums, no copays, just cash, or you didn't get any care at all. And that changed around the 1920s because a group of teachers in Dallas, Texas, prepaid a few cents a month to Baylor University Hospital just in case they needed care. Remember, around that time period in the 1920s, you had the Great Depression as well, so hospitals needed money too. And so, as a result of this group of teachers getting together, that's how you get the first insurance company, which we now know as Blue Cross Blue Shield. Here's the catch with early insurance coverage. It didn't cover dental or vision or your regular hospital visits. It only covered hospital care, if you needed to go to the hospital. So fast forward 30 years, 40 years later to the 1950s and 60s, and labor unions were fighting for better worker benefits. So they pushed hard to add dental coverage to this, especially for blue collar jobs that had poor working conditions and limited access to care. So the problem that you had, though, was that dentists didn't want anything to do with hospitals, the insurance companies, or people telling them what to do. So the labor unions are the ones that push for separate dental coverage, and that's how it's separated. And so then vision care came after that, but it wasn't for like eye disease, like cataracts and things we think of now. It was mainly like just a workplace perk that a job would offer for like eyeglasses and those type of things, not, like when your grandma has glaucoma. It was just a perk to help employees see better at work. That's how all the different types of insurance coverages got divided up. Wasn't biology or anything like that. It was all money and policy. But now we know better, so we know the problem is that your mouth and your eyes are deeply connected to your overall health. And for example, gum disease is linked to heart disease and diabetes. Eye exams can detect high blood pressure and even brain issues early. So we understand the connection now. So maybe it's time we rethink the whole system because, vision insurance and dental insurance and your eyes and your mouth aren't optional body parts. So I'll put this infographic at the end. As always, good question, Don. And please share and like the page.